Hello, my name is Dr. Robert Lockhart. I've been utilising inversion as a tool to help prevent back problems for 40 years. I worked with the original inventor, Dr. Robert Martin, back in California in the 1970s. We used to have patients coming in that had chronic back problems, many with multiple surgical operations that they'd had, and we got fantastic results utilizing the force of gravity to our advantage. So today in this video I want to tell you a little bit more about it and demonstrate some of the exercises that you can do in the inverted position in order to correct spinal problems, strengthen your core muscles, reverse the circulation in your body, so instead of all the circulation causing hemorrhoids and varicose veins, you can get upside down and get the blood to the brain where it's necessary to keep the arteries and the veins nice and elastic and the brain tissue and neurons fully charged with oxygenated blood. Okay. I was born in 1944, that makes me 70 now, and I've been utilising inversion for about 40 years. And if you don't have an inversion apparatus or a means of getting upside down, the next best thing to do is learn how to do some hanging by your hands and then progress to doing some handstands up against the wall, say. So a handstand can be done quite easily with assistance, but I'll just give a demonstration. Your hands should be planted probably half a meter from the wall, or maybe about 25 inches to 30 inches. You get upside down and your head's back because you're looking at the floor, you're looking at the ground, okay? And then you can gradually get your balance in your wrists and your forearms and your shoulders. See how I'm balancing? Right. So that's a way of getting upside down. Another easier way is to utilize the inversion boots. These are the best because they're the most comfortable. Bit of foam padding. Everyone's ankles aren't the same diameter, so you have to utilize a bit of extra foam if you've got thin ankles like me. I'll take off my shirt just so I've got a bit more freedom of movement. I used to be able to say 40 years ago, I'd take off my shirt and all the girls would go, "Wow!" But now that I'm 70, well, time's passed. Yeah. So you grasp the bar with your hands about shoulder width. Swing up, foot over and back. That's it. Now you just loosen up the spine. Once you're a bit more experienced, you can swing. Yeah. That feels really nice. So in doing that, as you can imagine, I'm loading the load on the intervertebral disc. So anyone with disc degeneration, herniated disc problems, this is the answer, because you're taking the pressure off the intervertebral disc and thickening out the intervertebral disc so that you'll gradually get the mobility back into your spine. To have a healthy joint, the first law of orthopedics states that you've got to have full range of motion in that joint. Second law is, in order for healing to take place, you've got to have blood supply, adequate blood supply. Now, this raises a question. Blood supply, if it's not of optimal quality, won't do you much good. So the quality of the blood supply is just as important as the quantity of blood supply. The quality of blood supply is derived from your diet. If you're on a cooked food Western diet,
the quality of your blood will not be optimal. If you're on a raw food, vegan, low-fat diet, the quality of your blood supply will be optimal and will promote healing. There is just no other compromises involved here. If you want to get well, go 100% low-fat, raw vegan. If you want to stay half sick, you'll stay half sick if you're eating cooked food. Even if you're eating vegetarian, organic, cooked food, you'll still won't get 100% well. Then you can do your sit-ups. You can do your squats. All with the weight off the joints. So in doing that, your joints are moving with frictionless ease. You are promoting the unusual inverted type of posture, which is opposite to the sitting and standing posture, which creates all the postural debt problems that you develop in your body. The postural debt problems result from the lack of blood supply getting to areas of the internal organs due to the effect of gravity pulling down on those organs. By uplifting the organs, allowing blood supply to get to areas where it normally doesn't get to, that's promoting the oxygen into those areas. So if you want to get cancer, and if you want to get colitis, if you want to get heart disease, liver problems, stay sitting and standing all your life, stay eating cooked food, and you're guaranteed to get all those problems. If you don't want to get those problems, get upside down and start eating vegan raw food, okay? Yeah. So virtually, you can do a workout within about 5 or 6 minutes on there and maintain the core muscles of your body. And if you do that twice a day is better than once a day, but even doing it once a day is good. Now this is the inversion table. I'm going to use the same boots on the inversion table in order to demonstrate that. I've just had another patient on here, so I've got to adjust it for my height. I used to be 5'10", but I'm 5'11" now because I've maintained my inversion throughout life. We had an interesting case when I worked with Dr. Robert Martin in Pasadena, California, of a patient that came in and wanted to get into the sheriff's department. The cutoff height at that stage for the sheriff's department in Pasadena was 5'6". He was 5'5½", and he desperately wanted to get in. He had 2 kids to feed and various things. So the cutoff time was to be in 2 weeks for the exam. We hung him upside down every day for 2 weeks. Within 2 weeks, we had increased his height by 3/4 of an inch. He got into the sheriff's department. He was happy, but he stopped doing the inversion afterwards. But he was in, he passed the test. He's still there as far as I know. So it can be done. If you've got the will, we've got the equipment. So you can hook up into the inversion table like that, and just by raising your arms, your body will go backwards. And up, you come up. So you can get fully inverted, and you can actually stay down there if you want to, just by locking your feet over there. You can do your sit-ups. Yeah. And rotations and extensions. Really good. We don't put our bodies into these unusual, uncommon postures like we should do. And you know what? When man was living in his natural environment, in the rainforests and the jungles, picking fruit, he would have to put his body in all sorts of positions just to survive. We don't have to do that anymore because we become sedentary animals sitting eating pizza in front of TV, whereas before, when we were really healthy, we might sit down under a tree after we'd been foraging all day, climbing, putting our bodies in all different positions because we had to get away from predators, we had to jump creeks, we had to swing on vines. We don't have to do that anymore. So therefore, we have to introduce into our lifestyle today something which will bring about those conditions which can promote health. And that's what this program is all about. Okay? First stage here is oscillation. Back, forwards. Simply by raising your arms, you'll go back. And what that's doing for my body here is providing a dumping effect. It's providing a dumping effect to the tissue fluids of the body. It's promoting a cerebrospinal fluid exchange, the fluid that surrounds the brain and spinal cord. It's getting rid of the ptosis. The ptosis means dropped organs. It means a fat gut. It means all the organs are pulled down into the pelvis. What you want to do is uplift those organs. Where do you find the most colon cancers? In the lower part of the colorectal tube, simply because of the crap that's in there and also the pressure of the other organs pressing down, preventing blood supply adequately getting to those areas of the colon, and therefore you get cancer forming. Cancer only forms